Hello, my name is Nicholas, and let's learn about a fractured clavicle, also known as a broken collarbone. The clavicle receives its name from the Latin clavicula because the bone rotates along its axis like a key when the shoulder is abducted. The clavicle is located between the rib cage on the shoulder blade. It is the bone that connects the arm to the body. The clavicle, or the collarbone, is a long bone that serves as a strut between the shoulder blade and the sternum or breastbone. It is the only bone in the body that lies horizontally. Did you know that without clavicles, our shoulders would drop in front of our chest, like those of a cat, dog, or horse? Our upper limbs could move forwards and backwards, but no slow pitch or jumping jacks with those limitations. In humans, clavicles act as struts to position shoulder joints and arms at the sides of the body. Positioning our upper limbs to our sides allows much greater ranges of motion. What is a fractured clavicle? A clavicle fracture, also known as a broken collarbone, is a bone fracture of the clavicle. It occurs in people of all ages, mostly under 25 and over 70. For young adults, the most common cause of a midshaft clavicle fractures is sports-related injuries. The mean age of patients with sports-related clavicle fractures is 21 years old. The mean age of patients with non-neonatal clavicle fractures is 8 years old. The clavicle is the most commonly fractured bone, accounting for 5% of all adult and 13% of all children fractures. The bone can crack just slightly or break into many pieces. It's called a comminuted fracture. The broken pieces of bone may line up straight or may be far out of place. It's what we call a displaced fracture. In a collarbone fracture, the break can happen in three areas of the clavicle. The midshaft clavicle fracture occurs in the middle portion, or shaft of the bone, generally from a hard fall or direct impact to the middle of the collarbone. Middle third clavicle fractures is the most common, accounting for 85% of all clavicle fractures. X-ray shows a fracture in the middle of the clavicle. Note how far out of place or displaced the broken ends of the bone are. A lateral clavicle fracture occurs near the AC joint and is the second most common, 10 to 15% of all cases. A fall or impact that transmits force to the outside or top of the shoulder can cause a fracture on the outer third of the collarbone, the part closest to the shoulder itself. Medial clavicle fractures occurs on the inner third of the collarbone and is the rarest type in less than 5% of cases. These are almost always the result of a direct blow to the front of the chest, such as from an impact with a steering wheel in a car collision. These are the bones affected by the injury. The clavicle bone that connects the breastplate to the part of the shoulder blade. Medially, clavicle articulates with the manubrium of the sternum at the sternoclavicular joint. At the other end, the bone meets with the shoulder area at the part of the shoulder blade called the acromion. Located directly above the first rib, it acts as a strut to keep the scapula in place so that the arm can hang freely. These are the muscles affected in the injury: the deltoid, the trapezius or trapezoid, the subclavius, the sternocleidomastoid, the sternohyoid, and the pectorals. These are the ligaments affected by the injury. The primary restraints to vertical stability of the distal clavicle are the coracoclavicular ligaments, conoid and trapezoid. The classification and treatment of distal clavicle fractures depend on where the fracture occurs in relation to these ligaments. The acromyoclavicular ligaments may be stretched, partially torn, or completely torn during the clavicle fracture. The sternoclavicular SC joint is the linkage between the clavicle, collarbone, and the sternum or the breastbone. The SC joint supports the shoulder and is the only joint that connects the arm to the body. The anterior sternoclavicular and posterior sternoclavicular ligament surrounding the SC joint are some of the strongest in the body, so it takes a great deal of force to cause an injury. Fracture of the clavicle is one of them. What causes clavicle fractures? The clavicle fractures are most often caused by a direct blow to the shoulder. This can happen during a fall onto the shoulder or a car collision. A fall onto an outstretched arm can also cause a clavicle fracture. In a baby, a clavicle fracture can occur during the passage through the birth canal. Collarbone breaks are common in contact sports like football, lacrosse, and hockey, and in sports where there is a chance of a hard fall such as biking, skiing, snowboarding, skateboarding, and volleyball. They can happen during a fall onto outstretched hands or during a fall onto the shoulder. The clavicle fracture can also be caused by a direct trauma to the collarbone during a car collision, motorcycle, or bike accident. In a baby, a clavicle fracture can occur during the passage through the birth canal. Having a high birth weight can make a baby more at risk for a collarbone fracture during labor and delivery. Signs and symptoms of a broken collarbone include pain that increases with shoulder movement, swelling, tenderness, bruising, a bulge on or near your shoulder, a grinding or crackling sound when you try to move your shoulder, stiffness or inability to move your shoulder. Newborn children will often not move their arm for several days following a birth-related collarbone fracture. The basic method to check for a clavicle fracture is by X-ray of the clavicle to determine the fracture type and extent of injury. In more severe cases, a CT or MRI scan is taken. The standard method of diagnosis through ultrasound and imaging performed in the emergency room may be equally accurate in children. When bones break, there is swelling due to bleeding from the blood vessels around the bone. There is also pain from the broken bone due to damage of microscopic nerve endings around the bone. Sometimes the bone is broken enough to create an angle between the broken ends, which causes a deformity along the bone. Usually with a broken collarbone, the pain and swelling are severe and they may be a visible deformity. Often there's a pain at the site of a fracture with any attempt to move the arm. Patients who have sustained clavicle fractures typically hold the affected arm adducted close to the body, often supporting the affected side with the opposite hand. This position is most comfortable because it limits the pull from the weight of the arm on the fractured bone. In a clavicle fracture, there is usually an obvious deformity or bump at the fracture site. Gentle pressure over the break will bring out pain. Although it is rare for a bone fragment to break through the skin, it may push the skin into a tent formation. The treatment varies on the type of clavicle fracture. Non-displaced or minimally displaced fractures in any location are typically managed non-operatively. This includes fractures of the midshaft, medial or lateral clavicle. The most common way to treat the fractures in the middle is with immobilization with either a sling or a special bandage called a figure-of-8 splint. Pain medication, including acetaminophen, can help relieve pain as the fracture heals. It is recommended that you ice the fracture area for 15 to 20 minutes every 2 hours for as long as necessary to decrease the pain and swelling. Surgery is often performed if the broken ends of the bone have significantly shifted out of place. Surgery typically involves putting the broken pieces of bone back into position and preventing them from moving out of place until they are healed. This can improve shoulder strength when you have recovered. Open reduction and internal fixation is the procedure most often used to treat clavicle fractures. During the procedure, the bone fragments are first repositioned into their normal alignment. The pieces of bone are then held in place with special metal hardware. After being repositioned into their normal alignment, the bone fragments are held in place with special screws and metal plates attached to the outer surface of the bone. Pins or screws can also be used to hold the fracture in good position after the bone ends have been put back into place. The incisions for pin or screw placement are usually smaller than those used for plates. Most broken collarbones heal without difficulty. Complications, when they occur, might include nerve or blood vessel injury. The jagged ends of a broken collarbone may injure nearby nerves and blood vessels. Seek immediate medical attention if you notice numbness or coldness in your arm or hand. Poor or delayed healing. A severely broken collarbone might heal slowly or incompletely. Poor union of the bones during healing can shorten the bone. A lump in the bone, as part of the healing process, the place where the bone knits together forms a bony lump. This lump is easy to see because it's close to the skin. Most lumps disappear over time, but some are permanent. Osteoarthritis, a fracture that involves the joints that connect your collarbone to your shoulder blade or your breastbone, might increase your risk of eventually developing arthritis in that joint. These are risks associated with any type of surgery. These include infection, bleeding, problems with wound healing, pain, blood clots, damage to blood vessels or nerves, and reaction to anesthesia. Risks that are specific to surgery for clavicle fractures include difficulty with bone healing, lung injury, and hardware irritation. Recovery of a clavicle fracture varies. For younger children, healing time can be as fast as 3 to 4 weeks. For teens, healing time is usually about 6 to 8 weeks. Fractures in adults or teenagers who have stopped growing take about 10 to 12 weeks to heal and may take longer. Most clavicle fractures will heal completely by 4 months in an adult. Immobilization is maintained for comfort and can be discontinued in 1 to 2 weeks or when the major pain subsides. Range of motion pendulum exercises can be started as soon as the pain allows, with gradual progression to active range of motion and strengthening exercises over 4 to 8 weeks. Therapy. Although there will be some pain, it is important to maintain arm motion to prevent stiffness. Often, patients will begin doing exercises for elbow motion immediately after the injury. After clavicle fracture, it is common to lose some shoulder and arm strength. Once the bone begins to heal, your pain will decrease and your doctor may start gentle shoulder exercises. These exercises will help prevent stiffness and weakness. More strenuous exercises will be started gradually once the fracture is completely healed. Return to activity recommendations for patients with midshaft clavicle fractures depend on patient age, level of contact, and presumed trauma risk. Before returning, an athlete should have full range of motion, normal shoulder strength, clinical and radiographic evidence of bony healing, and no tenderness or to palpitation. Patients usually can return to non-contact sports and full daily activities 6 weeks after injury. Contact and collision sports should be delayed for 2 or 4 months until solid bony union occurs. If surgery is performed, some surgeries recommend removal of hardware before returning to sports. However, plate removal may delay return to sports and is not recommended by other surgeons. Examples of a typical or non-operative rehabilitation exercises for a clavicle fracture. Shoulder blade squeezes. While standing with your arm at your sides, squeeze your shoulder blades together. Do not raise your shoulders up as you are squeezing. Hold for 6 seconds. Repeat 8 to 12 times. Wall angels. Start this exercise with your back against the wall and your hands raised above your head. Keeping your arms against the wall, bend your elbows and slowly lower your arms while squeezing your shoulder blades together. Repeat 8 to 12 times. Shoulder flexion while lying down. Lie on your back, holding a wand with both hands. Your palms should face down as you hold the wand or stick. Keep your elbows straight and slowly raise your arms over your head until you feel a stretch in your shoulders, upper back, and chest. Hold for 15 to 30 seconds. Repeat 2 to 4 times. Chest stretch while lying down. Lie on your back with your elbows bent. Your arms should be out to your sides, and your arms and elbows should be resting on the surface you are laying on, such as the floor. Raise your hands above your head until you feel a stretch in your chest. Hold for 15 to 30 seconds and repeat 2 to 4 times. Clavicle fracture stabilization, post-operative rehabilitation. Do not elevate injured arm above 90 degrees in any plane for the first 6 weeks post-op. Do not lift any objects over 1 to 2 pounds with an injured arm for the first 6 weeks. Avoid excessive reaching and internal rotation for the first 6 weeks. During week 1, pendulum exercises. Squeeze ball, triceps and with TheraBand. Isometric rotator cuff, external and internal rotations with arm at side. Isometric shoulder abduction, adduction, extensions, and flexion with the arm at side. During week 2 to 4, soft tissue treatments for associated shoulder and neck musculature for comfort. Gentle pulley for shoulder range of motion 2 times per day and limited range of motion for less than 90 degrees. During week 4 to 8, start mid-range of motion, rotator cuff external and internal rotations, active and light resistance exercises through 75% of range of motion as patient symptoms permit, without shoulder elevation, and avoiding extreme end range of motion. Strive for progressive gains to active 90 degrees of shoulder flexion and abduction. During week 8 to 12, seek full shoulder active range of motion in all planes. Increase manual mobilizations of soft tissue as well as glenohumeral and scapulothoracic joints for range of motion. No repeated heavy resisted exercises of lifting until 3 months. Thank you for listening to the sports injury webinar.